welcome to my channel Nursing Medicine. Today I'm going to deal with a sample station of Aptitude exam for nurses in Ireland. So let's see the sample station 1. As I told you before in my videos, this aptitude test has different scenarios in different stations. So today I'm going to deal with one of those scenarios. I'll read the scenario in this paper. Just listen to this. I'll write this one here as well so you can read as well. Mr. Brown is an elderly woman with end-stage pancreatic cancer. She is receiving end-of-life or palliative care. There is a do not attempt resuscitation in place. Her family lives nearby and has just gone home to have lunch, but have informed the nurse they have a strong wish to be beside her when she dies or passed away. The nurse assured the family that they would be connected if there was any changes in lady's condition. During the family's absence, the nurse observed that the patient has deteriorated. Her breathing rate has become less regular. She now has kindy-stop respirations. So your question is, contact the next of kin via telephone and communicate clearly, accurately and sensitively regarding Mrs. Brown's deteriorating condition. Establish and maintain a caring therapeutic interpersonal relationship with the patient's relative. Document record of telephone call. That is your task. That question, they are asking you to call the family. They are away or they are just nearby living. And you have to talk with the family because her mom or dad, the relative, is not well. So she is in the palliative care. Palliative care means end of the life. So she may going to die. And she has kindy-stop respiration. Kindy-stop respiration means like very labored breathing, and it may stop in between or slow breathing. So you know, as a nurse, you know what is kindy-stop breathing. So your task here is to call the family and inform her condition is deteriorating. And you have to tell them to come back to the hospital because they told you they like to or they have a wish to stay with the relative when she dies or when she passes away. That is your task. So in that task, you have to make sure you are speaking with the relative with empathy and in a calm tone. Don't be very panic when you are talking with the patient relative. Here what you have to do is, first of all, you have to go and check the document of the patient and make sure the patient is for DNAR. Because in the question they have mentioned the patient is for do not resuscitation status. What do you mean by do not resuscitation status? It's nothing but here the patient, if the cardiac arrest is happening for the patient, we don't want to resuscitate that patient because the outcome will not be good. That's why the medical team, the family, doctor and the nurses, everyone will discuss together and they will decide it is not necessary for resuscitation. So we have to take, as a nurse, we know the patient's breathing is going irregular. So we have to make sure the patient is for DNR. Otherwise, we should do the resuscitation. So that's what you have to do first. You have to take the document of the patient and make sure, yeah, she's not for resuscitation. Then you have to talk that, or you just tell that what you are reading. Just you are taking the document and reading. Maybe your examiner may not understand. It's better, yeah, the patient is not for resuscitation. Then go to the frame picture or wherever the contact details is there and take the contact number of the next of kin. Next of kin is a relative who is living nearby because you are a nurse, but you don't know by heart the number of the next of kin. So you have to take the file and make sure, check the number and dial the number. So it will be a real-time conversation sometimes or sometimes it's not. So it's depend on your exam stations. Anyway, most of the time it will be real-time conversation. So you have to take the phone and dial the number which was given in the file And first of all, you should introduce yourself. You will take phone. Hello, hi, this is me, so and so from this hospital, this ward. So when you are telling that one, you are from this hospital and the ward, there will be more panic, and you have to confirm, is that Mrs. Brown's mom, or Mrs. Brown's daughter or son. You can ask the name if they have given the name. And that is what we are introducing ourselves, and we are confirming that we are talking to the right person. Then you should have an empathy, and you know they just left from the hospital for the lunch, so you should talk with them nicely. You should tell, yeah, I know you just left from here for the lunch, but your Mrs. Brown's breathing is irregular, or it's not regular like previous. So it may be appropriate if you come back to the hospital. Then they will be so panic, and you have to make sure to reassure them. Don't worry, I'll be with Mrs. Brown until you come back to the hospital. So in that way, you're introducing yourself and you're making a therapeutic relation with the family, and you have that empathy towards the patient relative and the patient condition. And at the end, you have to make sure to thank you, because after you are disconnecting a phone, before that you have to thank you the person who is in the other side. And make sure to document whatever you are doing in the nursing field or in our ward or wherever. We have to document, isn't it? As a nurses, if we are not document, that means that doesn't happen. So we have to document. So this is the thing we have to do in that station. So don't be panic. No need to buy hard anything. Just talk, just understand that scenario and talk with the patient as usual. You all are nurses, so you have practiced in different places in India or in anywhere. So after that you passed IELTS and you did processing and you are coming to Ireland. So before that you have a test. So just they have to assess how you are dealing with this scenario or dealing with the situation. That's it. So you have to do what is your duties. That's all. That's all about this station. I hope this video is useful for those who is practicing for this aptitude test, or who is waiting for the decision letter, or whoever is planning to come to the island. So you can share this video to your friends, and don't forget to subscribe my channel and press the bell icon so that you'll be notified with my new videos. Thank you. Bye-bye.